Okay, so this is going to be my week 3 health assessment 2 videos. This is going to be over musculoskeletal. So the first thing I'm going to do is just walk into my patient's room. So I'm going to knock on the door, close the door behind me, do my hand hygiene as I walk in. I'm going to acknowledge my patient, introduce myself, let them know what I'm about to do, about how long it's going to take. I'm going to tell them I'm doing a musculoskeletal assessment. It'll probably take 10 minutes, and then thank them for letting me do the assessment. Next, I'm going to ask their name and their birthday and just verify it with their ID band. Then I'm going to assess their pain and then assess for any allergies. So just starting out, I'm just going to start with inspection, and I'm going to do my inspection kind of every, like, head to toe inspection, and then move on to like assessing like range of motion and like assessing strength and stuff like that. So starting out with inspection, so as they walk into the room, I'm just going to observe like their gait. I want to make sure and note if they're using any assistive devices. I'm kind of looking at their posture, so it should be, you know, like not hunched over. They should be sitting up straight. I want to know if they're, you know, looking at their stability. Are they stable on their feet? Are they unsteady? Looking at their foot position. So I think you're just looking at like if your feet are like kind of more inverted, you know, like everted. I think that's what we're looking for with foot position. And then just noting like their stride. So equal stride, it should be even. And then I'm going to assess their fall risk. So usually you ask like, you know, have you had any falls within the last like month, 6 months, or the last year? And if they answer yes, then that makes them like a higher fall risk. So if they have already fallen, they're automatically usually a fall risk because they've already fallen. So next, moving on, I'm going to inspect and just kind of palpate the timbomandibular joint. So I'm going to just kind of feel, and I'm going to have them open and close their mouth, and I'm just going to assess for like any pops or clicks. So, and I do have a little bit of popping, so, but that's okay. Okay, so next, I'm gonna just kind of do like the spine. It's really hard to show that on myself though. But normally, so I would kind of have my patient like bend over and like touch their toes, and then it kind of just like pops out the vertebrae so you can kind of feel down. So I can kind of show like, so I'm just kind of palpating, and I would go all the way down the spine, and I would just ask like, you know, do you have any pain? Any tenderness? You just want to feel for like any masses, anything like that. So I'm going to do that all the way down, so cervical, thoracic, and lumbar. And then I'm kind of looking at like the contour, and then I'm also looking at like I'm looking for any abnormal like curvatures along with that. So I want to rule out, make sure that they don't have any kyphosis, no lordosis, and no scoliosis. So after I palpate the cervical, thoracic, and the lumbar, I'm going to move on to, like I said, I kind of did inspection, palpation, kind of mixed together. But then I would move on to my upper extremities. So you want to palpate and inspect bilaterally. So you want to look at both of them. So you're just kind of like inspecting the joints, you know, kind of, I mean, just making sure, you know, no pain, no tenderness, like when you do like the shoulder one. And it kind of incorporates in with like when you do the range of motion, but you're just seeing, you know, like any pain, and you're assessing like bilaterally, just making sure. And you want to make sure that they're, you know, bilaterally like symmetrical as well. So then moving on, I'm going to inspect and palpate my hips and my knees and my ankles and my feet. So with my hips here, I'm just kind of like palpating, inspecting. I don't have any pain. And then I'm going to move to my knees. So sometimes that might be easier if your patient is sitting down, and then you just kind of like, you know, kind of move their leg out. And then assessing for like any pops, any crepitus, pain, tenderness, anything like that. And then the ankle here, it's kind of hard to see, but so you're just feeling around these joints and you're inspecting. I don't have any pain, I don't have any crepitus. No tenderness, no redness. So ankle here bilaterally. And then moving on to like your toes even too. No pain, no tenderness. Moving on to this foot. Okay, so after my lower extremities. Then I'm gonna move on to like my ROM, or my range of motion, let's say ROM, and my like muscle strength test. Okay, so now I'm gonna move on to my range of motion I'm gonna go through head to toe, entire body. So starting with my jaw, so I kind of had them like open and close already. So since I already did that with the TMJ, I'm not gonna reassess that. So I'm gonna do the protraction and retraction. So protraction would be like kind of like sticking their jaw out. So that would be protraction, and then retraction would be bringing it back in. Then I'm gonna move on to the neck. So I'm gonna do flexion, which is kind of looking down, and then extension, which is gonna be looking up. And then while I'm doing these range of motions, I'm gonna ask if like there's any pain. I'm kind of assessing like for any crepitus, like when they make these movements, I guess you'd say. So then I'm gonna do rotation. So I'm just looking from side to side, and then I'm gonna do lateral flexion on the left and the right. So I'm gonna do left and then right. And again, just assessing for like any pain. So then I'm gonna move on to range of motion on the spine. So I have them stand up. If I can see. Okay, so then I would do flexion, which is kind of like touching your toes. And then I would do extension, which is like kind of bending backwards. And then you could do like your lateral bends. So just have them like bend this way and then bend this way. And then again, just assessing for any pain, listening for any crepitus, anything like that. So next I'm gonna move on to my shoulders. So I'm gonna do elevation and depression. And then I'm gonna do circumflexion. And then I'm gonna do abduction and then adduction. So it's just bringing your arms back down. And then I'm gonna do my arm. So this is flexion, extension, and then I'm gonna hyperextend, so I'm gonna go back. And then I'm gonna go ahead and do my elbow one while I'm already at my arm. So this would be supination, and this would be pronation. And you would be doing this bilaterally. Just for sake of time, I'm only gonna do one side, but you should be doing it bilaterally to assess range of motion on both sides. Okay, so after elbow, then I'm gonna move to, so I did arm, did elbow, I'm gonna move down and I'm gonna do my wrist. So I'm gonna do flexion, and then extension, and then hyperextension. Wait, no, right, yeah. Sorry. So, flexion, can you hyperextend your wrist? I don't think you can. I think it's just flexion and then extension. I don't think you can hyperextend your wrist. I mean, you can a little bit, I guess, if you go really far back, but anyways. And then I'm gonna move to my fingers. So I would be doing flexion, extension, and then hyperextension a little bit, maybe. It's kind of hard. And then, so I would go ahead and do my Fallon test and my Tennel test while I'm here just kind of doing range of motion with my fingers. So my Fallon test, I'm gonna put my fingers together and I'm gonna hold them for 60 seconds. And if the patient experiences like numbness or tingling, then that would be a positive Fallon test. And then my Tennel test, so I'm gonna have my patient just kind of like have their arm out, and I'm gonna just like tap on this median nerve, and sometimes they'll feel like kind of like a shooting sensation, and that would be a positive Tennel test. So moving on to lower extremities. So for my hips, I'm gonna do, kind of off balance, sorry. I'm gonna do abduction and then adduction. And then for the knee, sorry, the knee is kind of hard to see. So flexion would be lifting up, and then extension would be just putting it back down. And then my leg would kind of be the same way. So you can do extension, so put your leg out, and then hyperextension would be putting your leg behind you. And then ankle, like ankle and foot are, they're kind of hard to see. I don't know if I can move my screen to show you and be in the picture too. Okay. Okay, so I'm gonna do, here, I'm actually gonna sit down. Okay, so feet and ankle. So you're gonna do inversion would be like moving your foot in this way. And then eversion would be moving it kind of out. It's really hard to do. So inversion and then eversion. And then plantar flexion, so you would put your hands like at the bottom here, and then you would have them push down. And then dorsiflexion would be having them like flex up. Okay, so next I am going to do my muscle strength. So I'm gonna just go through kind of again how I did range of motion. I'm just gonna go through and you're just kind of like giving resistance to make sure that you have like strength. So it's tested on a scale of 0 to 5. 5 is obviously what you want, and that's like your, you know, you have strength. It's like 5 out of 5. So that's what you want. So starting with the jaw. So when you have them open, you're gonna kind of push down, I guess. It's so hard. Push down and make sure that the strength is there. And then, so neck, so for flexion, so you would just kind of push down and have them kind of resist back. And then extension, same thing. You would just kind of have them push back. And again, just testing for, you know, on a scale of 0 to 5, testing for strength. And then, so rotation, you could have them kind of, I guess when you rotate, kind of like have them push on the side that you're rotating towards. So you could have them push on this side, and then on this side, have them push like on that side, I guess, to test strength. And then, so you could do your lateral. So you want to push, if you're going to the right side, then you would have them kind of push back on you when they're going to the right side, and then left side, kind of have them push back. Shoulders, so you would have them shrug their shoulders, and you would try to push down, and you would say, don't let me push your shoulders down. And then depression would just be just kind of letting them down. I don't think there's any way to test. But if they could go up, obviously they could go back down. And then circumflexion. So that one, I mean, it's kind of hard to test this one, I think. I guess right here, you could have them as they're circumflexing. You could have them like kind of push, but that one, I mean, you're just kind of pushing down when you're either back here or you're here. And then abduction, so that you're going to try to push down up here when you go up, and, you know, have them say, you know, don't let me push your hands down, and that would be your strength, and then going back down for adduction. So then arm would be flexion here, so you would push back and have them say, don't let me put your arm down, and then have them like resist you there. And then flexion, you could even like push down on your arm like that, and they're, you know, resisting you for that. And then hyperextension, so bringing your arm back and then pushing down on that side as well. Yeah. And then elbow, so supination, you could push down. I mean, yeah, supination. And then pronation, you could have them push down this way as well. But I feel like that's testing like, I feel like that's testing your arm strength and not really like your elbow strength, because like it's not testing, you can't really, it's hard to resist to do supination and pronation because it's testing more of your elbow and not your arm. So I did arm, elbow, so then wrist, I'm gonna do, so flexion, I would have them resist, and then I would do extension, so I would have them kind of resist, and then hyperextension, so then I would kind of have them resist, so not let them push it back down to normal. And then fingers, so flexion, extension, hyperextension. I guess I kind of did that. I kind of did that with wrist. I feel like it kind of goes hand in hand. I mean, not really, but kind of, sorry. So flexion, extension, and then hyperextension. So you would just be pushing down and making sure that they can resist from bringing it back up. Let's see, and then So I did arm, wrist, fingers. Okay, so lower extremities. So hips, again. Let's see. Okay, so adduction, so you're just kind of pushing and they're not letting you put your leg back down. And then abduction is just putting it back down. And then knee, so your flexion, and you're just like resisting to try and put it down, and they're resisting against you. And then, so flexion and then extension. So then you're kind of pushing down on the leg here to try, you know, resisting you. And then leg would be kind of like the same thing. So extension, you'd be pushing down, and then hyperextension, you would be pushing down their leg and you would have them resist against you. And then ankle. So ankle is kind of, I guess I'll put my thing back on the floor here. Actually, before I do that, I forgot. So when I was doing my knee, I need to do the McMurray's test. And, sorry, this is my self-identified break that I forgot. So what you would do is you would have your patient lay down in like a supine position. It's really hard for me to do that. So pretend I'm laying down, and you're gonna have your patient, you're just gonna relax, have them flex their knee, and you're gonna lift their knee up and just kind of like move it in, and you're just assessing for like any pain, any pops, any like if your knee is like locking up or if it's like giving out, could indicate like a meniscus injury. So you definitely want to test for that. When you're doing, you could do it when you're doing range of motion, but I think it works better with like the strength test because you're already assessing strength anyways, and you would want to do that before, I guess it doesn't matter either way, range of motion or when you're testing strength, it doesn't matter. Sorry, I forgot what it was. Oh, ankles, sorry. Okay, so put this back down here. So ankles, when you're doing inversion, you're just kind of pushing. So let's say I'm gonna do eversion or inversion here, and you're kind of pushing so you're not letting them push their foot back out. And then eversion would be pushing kind of the foot in and not letting it go back inward. And then when you do plantar flexion, so you're having them push down, and then you're gonna be pushing back up, trying to make them keep their feet down in plantar. And then dorsiflexion, you're gonna push down and try and pull their feet down, and they're gonna resist against you for dorsiflexion. Okay, ugh. Sorry, I'm gonna move this. Okay, and then so after I test my range of motion and my strength, that pretty much sums up my assessment. So I would just be assessing like during it, like I said, assessing bilaterally, and then you just want to make sure that they don't have any pain, no tenderness, listening for any like crepitus. You want to note any of that because that would be abnormal. So after that, I'm just going to reassess my patient's pain. I'm going to ask if they need anything, offer them any like comfort measures, comfort things. I'm going to thank the patient, and then I'm going to do my hand hygiene. After that, I'm also going to make sure that like the bed is in the lowest position, the wheels are locked, call light is within reach, like the bed or chair alarm is on, all that good stuff. And then I think I already said, yeah, already doing hand hygiene on my way out.